These are lessons that most nursing university students learn too late. Don't make that mistake. I'm a final year nursing student and I'm a fourth year nursing student, and today I really want to talk about what nursing students learn too late but should learn early. The first lesson that I really want to talk about is understanding is far superior than memorization. So when it comes to understanding in nursing university, it's quite important because a big chunk of the topics that we obviously study does not only require memorization but also requires the understanding. A lot of it is obviously will come handy when it comes to internship, when it comes to practice, when it comes to work. Because at that point, really there is a huge difference between the students that solely rely upon memorization and the students that really understand the topics. And when understanding, you don't really have to understand all the nitty-gritty of each and every point. But a lot of the times, you just need to have a very good general knowledge about the topic. Now, obviously, if we're talking about general knowledge, we're talking about nursing university student general knowledge and not just the general public general knowledge, which means it's a bit advanced. You obviously need to know the basics. You obviously need to know how the anatomy works, physiology, microbiology, pharmacology. But when it comes to the details, maybe you don't have to memorize all of them as long as you understand the entire concept. So the basics of the concepts has to be understood because a lot of the times you have to explain it to the patients' families. A lot of the times, well, all the times, you need to communicate it with other staff. Other staff members like nurses, health assistants, doctors, professor doctors. So if you don't have a good understanding, memorization alone can't really help it. Because sometimes those memorization words that you are memorizing and reciting by heart sometimes they don't understand it because there's different medical terms for the same definition. A lot of the times it happens. A lot of the times there's doctors from different countries. So how do you do that? Especially when it comes to specialties, sometimes there is other people from different countries and it happens, it exists a lot. So how would you explain it? Now, if you have a good understanding of the topic, it doesn't really matter. You are not bothered. Who cares? You will explain big whoops if you forget what's the medical term, as long as you understand it and you can actually explain it. Now, the second point that I really want to talk about when it comes to the mistakes or the lessons that nursing university students learn but too late and they should learn faster is asking questions is strength, not a weakness. So questions is probably by far the most important way to learn in nursing university, especially in internship. You are in the hospital, you already know a couple of things, but a lot of the stuff that we study in theory as a nursing university student is not applied in real life or is different from real life. Real life situations are complex. There is emotions, there's the fear of the patients, there is a lot of backstories that you were not even present when they happened. There is a lot of antecedents, which means the past of the patients. There is a lot of signs, there is a lot of staff, communication, a lot of medicine. You have a lot of pressure on you because there's other patients. So all of these come in handy or come in clutch. But asking questions is the only thing that will make you be able to go through all of them. One, asking questions to the patients. Asking him about how he is. If he's post-operation, you ask about if he has pain, how is he doing, if he actually went to the toilet, urinated, or etc. So whether number 1 or 2 or 3, it doesn't really matter. So you gotta ask those questions. You gotta make the patient comfortable. You gotta ask him what you gotta ask. Understand the patient's situation. On the other side, you should ask the nurses. As a nursing university student, the number one person to ask is nurses. They have experience. I'll say this caveat. I personally learn from nurses more than I learn from professors. Especially when it comes to practice. Because a lot of professors sometimes are not even nurses or they don't have that much of an experience when it comes to the field. But nurses, they do that, they breathe that every single day. Obviously, there is nurses and professors at the same time. There's a lot of them, but still nurses actually practice more than professors and nurses. Always, you have to ask them about everything you're curious about. I'm seeing an act for the first time in my life. What's that? Is it something new? Is it something I've never studied? Is it something that I studied and I forgot? Or sometimes it's just a different way. There's a different act. I'm gonna give this actually beautiful story. So in this local hospital that I've been to in 2 years in a row, so this year and last year, so the final year and the year before it, and I know the exact vaccination system in Morocco because I studied nursing university in East Morocco, so I know what's the vaccination system, obviously for kids. And I memorized it, I've made projects about it, etc. And I came back and I was in there and I was used to it. I came back this year and it was a bit different, right? At first you don't notice, but once you look at it, you're like, okay, there's differences. If I don't ask questions, I wouldn't even have noticed in the first place. I was like, okay, you have something wrong in here. Why didn't you update it? Why haven't you updated? She was like, no, this is actually more updated than the one you have. They have just updated it like 3 months ago. I wouldn't have known. Except if I asked questions, which is I did. Now, the third point that I really want to talk about is self-care affects performance directly. It would say, how does self-care actually help? Now, when it comes to self-care, it's very big and very neglected in nursing university because a lot of students actually just focus on grades, understanding the subjects, memorization, exam, the other exam, practice exam, internship exam, this exam, supervisor, this teacher, this nurse, this. Nobody really cares about themselves. And this is me noticing about my class and the previous classes. I've seen so many classes, yeah? All of them, a lot of them, are not in a good health. You can see it, right? That's a good thing about nurses, that you can see, you can know what happens just by looking. Not a lot of them, there's obviously obesity, it just doesn't exist. Most of them are skinny. I'll tell you like 80% of the girls are skinny. Now that's a problem, right? It's a problem. You are in a health system and you don't even take care of yourself. That's not cool. That's not what you're supposed to do. If you can't help yourself, you can't help others. Self-care is important. Whether that be in good sleep, good social life, good having habits and hobbies, having whatever it is that you want to do and express yourself with. Doing sports. If you like sports, especially if you're a man. If you're a woman, you want sports, do sports. Go for you. Kudos for you. Right? I do sports. I literally just trained about 1 or 2 hours ago. Because without that, I know my mental health will go crazy. I've been there in the first few years in nursing university. My mental health was in the wall. In fact, I have a best friend who was in nursing university. He was always the first in the class. His mental health was so bad. He was not taking care of himself. You can look at him in the eyes. Just look at him. His skin went darker. He was really unhealthy because he just wasn't sleeping, wasn't taking care of himself, wasn't training. He was playing football prior to nursing university. He stopped. That's not a good experience of nursing university. You're a nursing university student because you deserve it. And also, you deserve to take care of yourself. Because if you don't, you cannot take care of others. And actually, the reason why I said that self-care affects performance is that the more you will notice, the more you take care of yourself. So magically it happens that professors like you more, they give you better grades, colleagues want to work with you better and more, nurses like you. People just give you an unfair advantage and privilege that you get just because you take care of yourself. You look good, you shower, you train, or you do hobbies. It just is what it is. Okay. The fourth point that I really want to talk about is respect. Now, respect and attitude matters in hospitals. Respect is very big towards, especially two people. You have towards staff, so towards staff and towards patients as well. And the reason why it matters for both of them, Patients really have a very fast and good sense on respect. The moment you respect patients, they respect you back, they feel comfortable, they trust you more. And a lot of the times, actually, a lot of patients are educated as well. They know what you know, or not everything that you know, but they know a bit about their situation. So a lot of respects can actually give hope to them and help them express themselves in a good way. Staff, especially for people that have higher authorities over you, so as a nurse, maybe an older nurse, maybe another doctor, professor doctor, etc. So always want to treat others with respect. And the people that also have less authority over you. So let's say you're a final year nursing university student, and you have, let's say, a second year or first year. You don't treat them with disrespect, but also you're humble. You just treat them like every other colleague, and that I think is very important. Now, the fifth point that I really want to talk about, and is the last one, which is consistency beats last minute effort. Now, when it comes to consistency, and this is a caveat that I've learned myself. At the first year of university, for me, I was consistent, but I was doing it the wrong way. So I was consistent, I was always going to lectures, but I'll sit in the back instead of the front. I'll sit in groups instead of alone. Now, I go with consistency, I go and sit in the front row, just talk with the teacher alone. It's easy it's easy to remember the lecture, being honest. But last minute effort, I was doing it a lot, especially in first year. Whenever I have the exam, I just go all in, stress myself, stress. And I try to convince myself that somehow every other student are preparing better than me and are smarter than me, and I have to work a lot and harder just to keep up with them, which is an absolute illusion. It's not true. And that really is not a good long term, and it's not even good short term, because I will tell you, I will not prepare for an exam, and you do all of that, I'll beat you. 100%. Why? Because with the experience in nursing university, I realized that just being in consistency, just go to lectures, sit in the front row, take one paper and one pen. That's all you need. No fancy notebooks, no fancy colors, no fancy highlighters. That's how I like to do it. It might be different. That's how I like to do it. And you just go there and you just listen to the teacher. Talk with him, right? It's easy to talk with him then, trust me. And also it's easier for the teachers to remember you. And you just talk with him. And I never revise, which is crazy. At the end, when the exams come, I have okay, well, there's 1 hour until my exam. I look at the notebooks. I look at my notes. I already understand everything. I was sitting in the front row. That's consistency. And that is really big. And a lot of nursing university students, including my friends, unfortunately, they do it the opposite way. So in lectures, they go back. Some of them even watch movies. Let's be honest, we all know. You watch movies, you play whatever games on your phone. In final exams, you're stressing yourself and you're like, how can I do this? How can I do this? I'm comfortable then. But in lectures, I was always in the front row, right? So it's a bit different. And consistency beats last minute effort every single time, especially for nursing universities. And unfortunately, most people don't really learn it early, just too late, but they should learn it early. Now let's do a quick recap. The first thing is understanding is far greater than memorization. Number 2, ask questions a lot, especially in internship. It's quite important. Number 3, self-care is king in nursing university. You cannot take care of others if you don't take care of yourself first. Number 4, respect. You have to respect patients, staff, and respect yourself. Number 5 is consistency is absolute king. Give it a crown right here. Consistency is king in comparison to last minute effort. Now, please write down in the comment down below what is your biggest problem that you're facing in nursing university, and I'll make sure I make a video about how I fixed it myself for myself. Thank you.